What happens during prenatal screening?
If you choose to have prenatal screening and present for prenatal care early in your pregnancy, your healthcare provider will arrange for you to have 2 blood tests. These blood tests can be drawn in any laboratory across BC. Now, if you have an increased chance of having a baby with Down syndrome or trisomy 18, or if you're expecting more than 1 baby, you may also have a special ultrasound called a nuchal translucency ultrasound, or NT ultrasound. This ultrasound must be done by someone who's been trained and certified, and is only available in a limited number of centers around the province. Now, I'd like to point out that having only the blood tests provides a very good screen for these conditions. NT provides additional information for women who have an increased chance of Down syndrome or trisomy 18. The blood tests and the NT ultrasound are entirely safe for you and your baby and can be done with very minimal discomfort. Results of the screen will be available approximately 10 days after you've had the second blood test.
When does screening happen?
The timing of the blood tests is very important. The first blood test is done just after 10 weeks and before 14 weeks. And the second blood test is done just after 15 weeks and before 21 weeks. If you miss the first blood test, you can still have the second blood test, and it will provide you a good screen for Down syndrome, trisomy 18, and neural tube defect. Doing both blood tests increases the accuracy of the screen result. The nuchal translucency ultrasound is done between 11 and 14 weeks.
What are my chances of having a baby with one of these conditions?
2 to 3% of babies are born with a physical condition which is diagnosed at birth. This 2 to 3% includes a wide variety of conditions. Some can be life-threatening, like having a serious heart defect. Some are treatable, like having a cleft lip. And some are really trivial, like having an extra toe. Prenatally, we cannot diagnose all physical conditions. All women have a chance of having a baby with Down syndrome, trisomy 18, and neural tube defect. While some couples may have an increased chance, these conditions are not usually inherited. They occur by chance. 1 baby out of 700 is born with Down syndrome, and 1 in 6,000 with trisomy 18. The chance of Down syndrome and trisomy 18 does increase with mother's age. 1 baby in 1,000 is born with a neural tube defect. This chance does not change with mother's age. But remember, most babies are born healthy.
Is prenatal screening the right choice for me?
Whether or not to have prenatal screening is a very personal decision. Some women do choose screening because they want to know if their baby has an increased chance of one of these conditions. And by and large, they're prepared to have diagnostic testing, which will give them the definite answer.
My name is Mary, and I have 3 wonderful daughters that came into our life when I was 34, 36, and 38 years old. And during each of the pregnancies, we felt it was important to have information that allowed us to understand the situation.
I was 30 years old with my first pregnancy, and it was a difficult first trimester. There were a few complications. So my husband and I opted to go for prenatal screening to get some more information about how the baby was developing.
For the first 2 children, we decided with the results of the test that the risk was low enough that we were comfortable and felt that we could really enjoy the pregnancies with the assurance that we were making the right choices and doing the right things to prepare for our children. However, in the case of our 3rd daughter, Kate, there was a higher risk rating that we received, and as a result, we decided for a couple of reasons to proceed with an amnio test. The concern that we had, or how we were feeling, was that with 2 young children at home and a possibility of having a complicated 3rd child, we wanted to be prepared for that. We wanted to have that information. And so we proceeded to have the amnio test done. We got the results from that, and fortunately, we have 3 healthy little girls.
The process itself was quite comfortable, and we found it to be reassuring. We got a lot of good information out of it, And if looking back on the pregnancy, if I could do it all again, I would again choose to go for prenatal screening.
Some women choose not to have screening. For some of these women, it's because they're concerned about the possibility of having a positive screen, which would bring them a lot of worry. For other women, it's because they know they would not have the diagnostic test because of the risks associated with amniocentesis. And for other women, it's because they know that they would not change anything about the pregnancy regardless of the screen result.
I'm 28 years old and 36 and a half weeks pregnant. I chose not to have the prenatal screening test. My husband and I decided this because we, under no circumstance, would terminate the pregnancy. And we thought that any result that we get back that would be positive would add stress to the pregnancy. And we just wanted to enjoy this time as a beautiful and amazing part of our lives.
But ultimately, the decision is up to you.
Is the prenatal screening process the same for everybody?
Prenatal screening varies somewhat depending on what stage you are in your pregnancy when you first present for prenatal care. It also depends on whether or not you're having twins or triplets. Finally, it depends whether or not your chance of having a baby with Down syndrome or trisomy 18 is increased because of your age or your personal or family history. Talk to your healthcare provider. He or she will be able to tell you which option is available to you should you desire screening.
If I am less than 14 weeks pregnant, what is my prenatal screening option?
For women under 14 weeks, 2 blood tests will be taken. The first blood test is taken just after 10 weeks and before 14 weeks. The second blood test is taken just after 15 weeks and before 21 weeks. The combination of these 2 blood tests is called Serum Integrated Prenatal Screening, or SIPS. For women who have an increased chance of having a baby with Down syndrome or trisomy 18, a nuchal translucency ultrasound may be added. This is done between 11 and 14 weeks. The combination of the 2 blood tests and the nuchal translucency ultrasound is called Integrated Prenatal Screening, or IPS.
If I am over 14 weeks, what is my prenatal screening option?
You can still have a single blood test drawn between 15 and just before 21 weeks. This single blood test is called the quad screen.
I'm over 35. Are there any other options for me?
If you are over the age of 35, you have an increased chance of having a baby with Down syndrome or trisomy 18. In addition to the 2 blood tests, you may be offered a nuchal translucency ultrasound. These special ultrasounds are done in a limited number of centers in the province. Adding the nuchal translucency ultrasound to the blood test reduces the chance of having a false positive screen result. However, doing only the blood tests has a very high detection rate of Down syndrome and trisomy 18, so it is a very good screening option. If you are 40 years or older at the time of delivery, you will also have the option of going directly to a diagnostic test such as CVS or amniocentesis without prior screening.
I have a personal or family history of one of these conditions or other health conditions. What can I do?
If you've had a previous child with Down syndrome, trisomy 18, or neural tube defect, or if you or your partner was born with a spina bifida, you do have an increased chance of having an affected child. Discuss this with your healthcare provider. He or she may suggest that you be seen by a genetic counselor who would review your history, discuss your chance of having an affected child, and review your screening and diagnostic options. Also, if you are known to have an increased chance of having a baby with a neural tube defect, it is recommended that you use higher doses of folic acid supplementation prior to conception. Discuss this with your healthcare provider.
I'm pregnant with twins. What are my options?
Depending on your age and how far along you are in your pregnancy, you have different screening options to consider. If you are less than 14 weeks and you are carrying twins or triplets, if NT is available, that is the best screening option for you. If NT is not available, you will be offered the 2 blood tests. If you are greater than 14 weeks, when you find out that you are carrying twins, the second blood test will be offered to you. If you are 35 to 39 and NT is not available, you will have the option of an amniocentesis without prior screening. If you are carrying triplets or more, talk to your healthcare provider to review your screening options.
But I want to know for sure, why can't I only have a diagnostic test?
To know for sure, you would need to have either a CVS or amniocentesis and chromosome analysis. Both procedures are associated with the risk of losing the pregnancy, and the testing is expensive. These tests cannot be offered to women who have a low chance of having an affected child.